Hi, in this video we are going to cover the topic health effect of chemical at workplace. It is a topic under epidemiology and toxicology, and it is a syllabus of NEBOSH International Diploma, ID2 of new syllabus and IB1 of the old. So in this video our learning outcomes will be the classification of dangerous chemical, then health effects, then health hazard classes, common workplace chemicals and associated toxic effects, and harmonization of international review of health effects. So the classification, now we are going to see the classification of dangerous chemicals. So the ILO Chemical Convention C170 calls for the classification of chemical by their hazardous property. In an effort to standardize in this area, the United Nations has implemented a globally harmonized system of classification and labeling of chemical, that is uh, in a short called GHS. This is a non-legally binding international agreement which establishes a new harmonized criteria for the classification of chemical according to their hazardous property and new harmonized labeling and provision of information requirement, including new hazard warning symbols, that is the pictograms for the labels. So now we are going to see health effects. So this can be classified as local and systemic effect and target organs. So the local first is the local effects. So these are confined to the specific area of the body where contact with the toxic material occurs, such as skin, eye, respiratory tract, etc. For example, a sensitizer may cause a specific allergic reaction on contact with the skin or respiratory tract. An irritant may cause local irritation to the eye or skin after contact at those sites. The next is the systemic effect. It occurs at the organ or the part of the body distance from the site where the initial contact with the toxic substance was made. It may be that the entire body system is affected by the substance or several different parts of the body and system. For example, the lead inhaled into the lungs as a fume will affect the central nervous system and blood forming organs and be incorporated into the bone. Carbon monoxide inhaled in the lungs will combine with the hemoglobin of the blood to inhibit oxygen transfer through the circulatory system. So it occurs at the part of the body distance from the site where the initial contact with the toxic substance was made. So this is called systemic effect. Next is the target organ and the target system. An organ is a group of structurally distinct tissues which perform some specific function or a set of functions. For example, heart, liver, lungs, etc. Everything is made of tissue and a group of tissue forms an organ. So organs are linked to one or more body system such as respiratory or circulatory system. So the toxic substance do not present the same degree of toxicity to all organs. Their toxicity may be concentrated in a few organ or a system referred to as target organ or system for that toxin. For example, carbon tetrachloride, also the formula is CCl4, affects the liver causing jaundice and scarring. Mercury affects the central nervous system causing narcosis and brain damage. So now we are now we will consider the different health hazard classification of the GHS. So health hazard can be classified as very toxic, toxic, and harmful. So the very toxic produces serious, acute, or chronic ill effect or death at very small doses. So what is acute and what is chronic? So acute is a short-term exposure to the high concentration, and the chronic is the uh, exposure over a longer period of time to concentration of the chemical. So a very toxic classification of the chemical under the GHS is if it produces serious, acute, or chronic ill effect or death at very small doses. Now the next is toxic. So it also produces serious, acute, or chronic ill health or death at small doses. The next is harmful. It produces serious, acute, or chronic ill health or death at larger doses. Note that these words have a general meaning in common use, but also have a technical meaning in the context of classification and labeling. In this respect, it is the precise dose of the substance that is needed to produce a particular degree of ill health or fatality that determines whether the substance is categorized as very toxic, toxic, or harmful. So under GHS, the acute toxicity is assessed and assigned to one of the 5 categories, with 1 being the most toxic and 5 being the less toxic. So the toxicity is determined on the basis of potential oral, dermal, and inhalation toxicity, and specific label elements are determined as a result of assessment as shown in the following table. So basically, under the GHS, the acute toxicity are classified under 5 categories, and on the basis of whether it is a oral hazard, dermal hazard, or inhalation hazard. So the various categories have been assigned the various symbols. So we can see the category 1, category 2, and category 3 have a skull and a crossbone symbol. Category 4 has an exclamation mark, and category 5 has no symbol. So the skull and crossbones are considered as danger as a signal word, and exclamation mark is a warning, and no symbol used is also has a warning. So now we will see the oral hazard. So under the category 1, it is under the now first we will see the category 1, 2, and 3. Category 1 and 2 are basically fatal, means if the concentration if the person is exposed to that chemical and which falls under category 1 and 2, then if it may result in the fatal, but it depends whether the chemical route of entry is oral, dermal, or through inhalation. And category 3 is considered as toxic, and category 4 is harmful, and category 5 is maybe harmful. So for example, if the chemical is having a oral hazard, means route of entry is through the oral, then if it is under the category 1, then it will be fatal if swallowed. Similarly, if it is a dermal, then it will be under category 1 as fatal in contact with skin. And under category 1, if it is a inhalation route of entry, then it will be fatal if inhaled. So similarly, category 2 is also fatal if swallowed, fatal in contact with skin, and fatal if inhaled. But under category 3, it will be toxic if swallowed, toxic in contact with the skin, and toxic if inhaled. And the category 4 is harmful if swallowed, harmful in contact with the skin, or harmful if inhaled. And category 5 may be harmful if swallowed, may be harmful in contact with the skin, and may be harmful if inhaled. So basically, under GHS, we are classifying the chemical based on its hazard, and also we are concerned with the labeling. So the labeling as a category 1, 2, 3, or 4 or 5 for the chemicals having the acute toxicity. So the acute toxicity is basically exposure of the person to a chemical over a short period of time to uh, a higher dose or a higher concentration of the chemical. So the two symbols referred in this table are the skull and bones and exclamation mark symbol. So now we are going to see the common workplace chemicals and its uh, health effects and the associated toxic effect. So the first is the trichloroethylene. So a trichloroethylene is a colorless, it is non-flammable organic liquid. The first is it is an organic liquid, it is colorless as well as it is non-flammable. So it is widely used as an industrial solvent. So it is used extensively for degreasing and cleaning of the metal parts, dry cleaning of the clothes, and the solvent extraction of the oils, fats, and waxes. So a trichloroethylene is harmful by inhalation, prolonged skin contact, and ingestion. So all the three categories under the GHS, the trichloroethylene falls. So it mainly attacks the central nervous system, the skin, and the respiratory tract. So the early symptoms are of the prolonged exposure includes headache, dizziness, irritability, mental confusion. Later additional symptoms may include visual disturbance, nausea, vomiting, gradual loss of consciousness, nerve paralysis, and cardiac irregularities may occur. So the next common workplace chemical are asbestos. So typically it is used for insulation and fire resistance material. It is a common friction lining in machinery, brake, clutches, plate, etc. So the asbestos is associated with the development of asbestosis, lung cancer, and mesothelioma. So asbestosis, first we are going to discuss the asbestosis. So it is a collagenous pneumoconiosis induced when the fibers are inhaled into the lungs alveoli and then migrate into the surrounding tissues. So the alveoli is the place inside the lungs where the gas exchange takes place between the blood. So there are many blood vessels which covers the alveoli, and it has a very thin uh, means thin the covering through which the exchange of the gases takes place. So the fibrotic reaction caused by asbestosis leads to a progressive development of inelastic scar tissue and thickening of the pleural membrane. The main symptoms of asbestosis are breathlessness, coughing, pain between the shoulder blades or behind the sternum, that is the breastbone. In the later stage of the disease, the lung function is markedly reduced and with the complementary heart strain, which may result in death. So basically, it results in the scarring of the tissue, and so it will be difficult to breathe, and ultimately it produces stress in the heart, which results to the death. So next is the next effect of the asbestos is the lung cancer. So it is the cancer of the lung tissue. The risk to the person working with the asbestosis of contracting lung cancer has been shown to be 10 times that of the general population. So the person working with the asbestosis are 10 times more in risk of the lung cancer than the general public. So the combined effect of the smoking tobacco and working with the asbestosis is another factor in the development of the lung cancer. In this case, the risk to the asbestos worker who smokes compared with the non-smoking general non-smoking worker, we can say, is 90 to 1. So the next health effect of the asbestosis is mesothelioma. So it is a cancer of the pleural membrane surrounding the lungs. So it appears that asbestosis fibers are able to migrate through the lung tissue following inhalation and can have a toxic effect on the adjacent tissue. So the next chemical is isocyanates. So isocyanates are the organic solvent which are used in paint spraying, commonly known as two-pack paints, and the foam rubber manufacture. So several different types exist, like hexamethylene diisocyanate (HDI), toluene diisocyanate (TDI), and methane diphenyl isocyanate (MDI). So both HDI and TDI acts as irritant and allergen. Excuse me. So the irritant effect includes inflammation of the mucous membrane of the nose, throat, and bronchitis. So the symptoms and the signs clear rapidly after the worker is removed from contact with the isocyanates. So next effect of the HDI and TDI is the sensitization, which can occur leading to the violent recurrent symptoms after further contact with even very low concentration of the isocyanates. So some workers are known to suffer from the chronic form of asthma. So, sensitization effect leads to a chronic uh, effect in the form of asthma. So, all isocyanates have very low occupational exposure limit. Asthma caused by diisocyanates is now recognized as the occupational disease qualifying for the compensation. Next chemical is the siliceous dust. So, pneumoconiosis is an accumulation of dust in the lungs and the tissue reaction to its presence. So, a collagenous pneumoconiosis involves permanent alteration or destruction of the structure of alveoli, which is a area in the lungs where the gas exchange takes place, and a permanent scarring of the lungs as a result of chronic inflammatory response. Dust that contains silica are like coal dust, rock dust, and even pottery dust can cause silicosis. This is a form of collagenous pneumoconiosis caused by inhalation of respirable particle of free silica. So in the early stage of the silicosis, there may be only limited areas of collagenous pneumoconiosis which develops as the condition intensifies. The symptoms include breathlessness on exertion, coughing with associated sputum, and chest pain. So in the later stage, the impaired lung function puts a strain on the heart, and death may result as a combination of lung and heart failure. So the next workplace chemical is lead. So a lead metal in its massive solid state has no ability to be absorbed in the blood body by any of the three normal modes of entry, that is inhalation, ingestion, or skin absorption. As a fume or a very finely divided dust, lead inhalation becomes a serious risk as a potential mode of entry. So a lead compound can be categorized as inorganic lead and organic lead. So inorganic lead, for example, lead oxide in a lead acid batteries, and lead chromate, that is chrome yellow, red lead used for the pigment, are the few examples of the organic lead. For an inorganic lead compounds, inhalation of the dust generally poses the most serious situation. Next is the organic lead, for example, petrol knocking, anti-knocking agent, lead tetraethyl. So for organic lead compounds, inhalation and skin contact are the main occupational mode of entry for absorption in the body. So the inorganic lead, uh, basically, uh, the route of entry is through the inhalation of the dust, whereas the organic lead is through the inhalation as well as the skin contact. So the intoxication by the inorganic lead compounds lead to general symptoms related to the gastrointestinal tract, the nervous system, and the blood. Whereas the organic lead, that is tetraethyl lead, can have fatal consequences. Its absorption into the body mainly affects the central nervous system, producing restlessness, raised level of excitement, and talkativeness, then muscular twitching, and possibly delusion, acute and violent mania. So the fall in the body temperature and drop in the normal blood pressure are followed by the exposure to the organic lead. At the lower level of intoxication, the headache, vertigo, fatigue, and a sense of physical weakness and insomnia with disturbing dreams are classical symptoms of this organic lead. So now the next category is the corrosive and the irritant chemical. The symbols we can see for the corrosive as this one, having a test tube with a acid, uh, and the next symbol for the irritant chemical is the exclamation mark. So according to the GHS, the skin corrosion is the production of the irreversible damage to the skin through the epidermis and into the dermis. Corrosive substances often have a high or low pH, that is, they are acid or alkalis. Often, one of the key determining factor in distinguishing between a corrosive substance and an irritant is the concentration. Many acids and alkalis are corrosive in their neat or concentrated form, but acts as an irritant in their dilute form. As the dilution increases, so the irritant effect decreases. So now we will see the few chemicals, common workplace chemicals, which are corrosive. So the sulfuric acid. So the sulfuric acid is a corrosive substance capable of destroying the living tissue. The concentrated sulfuric acid will cause severe burns to the skin on contact unless washed off immediately. Similarly, any contact with the eye is likely to cause immediate serious damage. Inhalation of the acid mist or fume will cause severe damage to the respiratory tract. Accidental ingestion will cause corresponding damage to the gastrointestinal tract. The dilute acid irritates the eye and the skin and may cause burns and give rise to the dermatitis. Next is the sodium hydroxide. So it is a strong alkali which is also known as caustic soda and occurs as a colorless sticks, flakes, powder or pellets. It is very soluble in water and is often used for such tasks as cleaning and unblocking drains. So the solid and its concentrated solution causes severe burns to the eye and the skin, and if taken by the mouth there are several internal irritation and damage, and fairly weak solutions are also able to cause eye damage. So the next category is the sensitizing chemicals. So under the GS, the respiratory sanitizer will be assigned a health hazard symbol of the exclamation mark. So some chemical agents are able to produce an allergic reaction in certain individual. So the antibodies are produced which are capable of triggering an allergic reaction each time the person is subsequently exposed to a very small quantity of the causative agent. Two blood systems, two body systems are prone to sensitization by the chemicals are skin and the respiratory system. So basically it causes allergic reaction. So for the skin, the sensitizing chemical passes through the epidermal barrier causing antibodies to be formed, and this produce the symptom associated with the sensitization dermatitis. And once this happens, the skin reaction will occur whenever there is further contact with the sensitizing agent. Now the next body part, body system that is prone to sensitization by the chemical is the respiratory system. Allergic sensitization occurring in the respiratory system results in asthma. The mechanism of the occupational asthma is the abnormal immunological response to the foreign material which acts as an antigen, that is a foreign substance which causes body to produce antibodies. The inhalation and absorption of the antigen causes the production of the specific antibodies, which triggers the release of the histamine, causing the bronchial constriction. So basically, asthma, occupational asthma is an abnormal immunological response to the foreign material. So the foreign material is antigen, which is a substance produces, which causes the body to produce antibodies. And this inhalation and absorption of the antigen produces the antibodies, which results in the production or the release of the histamine, causing the bronchial constriction. Next category is the carcinogenic chemicals. So it causes cancer. The symbol we can see here, and the carcinogen attacks the mechanism which controls the reproduction of the normal cell. It causes changes in the cell's DNA, resulting in abnormal cells which divides uncontrollably and so produces the growth of abnormal tissue. The cell grows, spread, invade and destroys the surrounding tissue. The effect of the carcinogenic agent will not appear for many years after exposure. Periods between 5 and 50 years are given for different agents. During this time, there is little or no warning of the eventual outcome. Example of the carcinogens includes asbestos, vinyl chloride monomer, wood dust, chromium used in alloy. So under the GHS, that is Global Harmonization System, there are three categories of carcinogen. Depending upon the level of available evidences suggesting that cancer can arise from the exposure. So the labeling varies according to the category of the carcinogen. So the three categories under GHS are category 1A, category 1B, and category 2. So category 1A carcinogens are known to cause cancer from human evidence from historical exposure. Category 1B carcinogens are presumed carcinogens due to the presence of strong animal evidence of cancer causing potential. Category 2 carcinogens are suspected carcinogens for which there is insufficient human or animal evidence to place them in category 1. So under the GHS, all carcinogens will be assigned the health hazard symbol. So the next chemical category are the germ cell mutagenic chemicals. So under GHS, the germ cell mutagens will be assigned the health hazard symbol. The mutagens causes change or mutations in the cells of the person. The damage to the DNA caused by mutagens may possibly go on to cause cancer. All carcinogens are also mutagens, but not all mutagens are carcinogens. The DNA mutation happens constantly in the cell of the body. So most mutations are benign and of no consequence since they occur in the part of the genetic code that are not used. So occasionally a mutation may occur in important area. This often leads to the cell death either directly or as a result of cancer prevention mechanism. So it is actually a natural phenomena, the DNA mutations in the cells of the body to prevent the cancer. It is a mechanism. For example of the mutagen is the acrylamide, which is formed naturally when starch-rich foods are fried, toasted, grilled, etc. For example, the chips and the roast potatoes. Another example is potassium dichromate, which is used in the explosive, safety matches, dye manufacture, and photography. So occasionally, however, mutation occurs in the cells that have harmful effects. So in ordinary body cells, this may cause cancer. In the germline cells, that is egg in the ovary of a woman or the sperm producing cells in the testis of the man, this can lead to inheritable genetic defects being passed down to offspring. This is known as germ cell mutagenicity. Now the next category of the chemical is the toxic to reproduction. So according to the GHS, the reproductive toxin results in either adverse effect on sexual function and fertility in adult male or female, or the developmental toxicity in unborn or breastfeeding children. So many organic lead compounds have been linked to increased level of sterility, miscarriage, and birth defect. Birth defect occurs as a result of chemical interfering with the critical stage in the development of the child as it grows in the womb. Importantly, this is not due to mutation as the child is genetically normal. The drug For example, the drug thalidomide is an example of a reproductive toxin, though it is not a workplace chemical. So, a reproductive toxin which damage fertility or the unborn child will be assigned the health hazard symbol under the GHS, but no symbol has been assigned to the substance which causes harm to the breastfed child. So, the next category is the dermatitic hazard. So, the dermatitic hazard accounts for about 70% of the industrial diseases. So the occupational dermatitis can be classified into two main forms, that is primary contact dermatitis and secondary or allergic or sensitization. So the primary contact dermatitis is the condition caused by contact with the substance called primary cutaneous irritants. So a dermatitis occurs at the site of contact, provided the irritant acts for a sufficient time and in sufficient concentration. So a direct attack on the outer layer of the skin causes tissue destruction or degreasing, allowing the absorption into the active area of the skin where inflammatory condition can develop. So inflammatory is the immune response of the body. So after the removal of the operative from the contact with the irritant, recovery generally occurs. Now the primary contact dermatitis attacks the cutaneous part of the skin, and which leads to the degreasing or the tissue destruction, which further allows the absorption in the skin area or the active skin area where the immune response condition can develop. The next uh, classification of the occupational dermatitis is the secondary allergic sensitization. So, a dermatitis is caused by the substance called cutaneous sensitizer. So, previously we saw primary cutaneous irritants, and it is now the secondary one is the cutaneous sensitizer. So, this substance do not always cause an inflammatory response on the first contact, but may take a week or a more to develop. So under GHS, the dermatitic hazard have been assigned the exclamation mark symbol. Now the next category is the specific target organ toxicity. So some substance have a toxic effect on the target organs and system. So this can be as a result of single exposure or multiple exposure over a lifetime. So human and animal evidence may indicate the potential for the substance to be toxic to a particular target organ or system. So occupational exposure to some substance can result in a similar pattern of effect. For example, inhalation of the solvent vapor may intoxicate, targeting the brain and the central nervous system, or may prove fatal. The liver may also be affected on repeated exposure. Under GHS, substances which are target organ toxins through single exposure or repeated exposure will be assigned the health hazard symbol. Next category of the chemical is the aspiration hazard. So some chemicals are harmful by aspiration. The aspiration is the inhalation of the liquid directly into the lungs. Such chemicals can have a very serious or even a fatal consequences if aspirated. There is no specific symbol for the aspiration hazard. However, warning will be contained within the label or the safety data sheet. So as we saw, the acute toxicity table of category 1 to category 5. So warning symbol for the category 5 have been assigned. Now our last topic is the harmonization of the international review of health effects. So the effort has been made to form a standardized system. For example, the production of the concise international chemical assessment document CICAD, which are published by the International Program on Chemical Safety. IPCS, that is International Program on Chemical Safety, is a joint venture between the World Health Organization, the International Labour Organization, and the United Nations Environment Program. So the concise international chemical assessment document are the summary documents which details the relevant scientific information from the selected national or regional chemical evaluation document.